Well, the Department of Basic Education has gazetted a set of directives to further provide clarity and guidance on a variety of matters in the COVID-19 environment. Now, it emphasizes strict adherence to all health and safety requirements, and it also confirms the phased return of other grades. And this, the department says, is to further provide clarity and guidance. Now, at the time of reopening of schools, Minister Angie Motshekga's decision was met with apprehension, and some even calling for the minister to reconsider. And in addition, Equal Education Law Centre, representing equal education and Section 27, wrote to the department highlighting concerns on the lawfulness and constitutionality of certain aspects of the original set of directives. Now, joining us now for this discussion is the Director General for Basic Education, Mathanzima Mweli. Thanks so much for your time this morning.
Good morning, Sakina, and good morning to your viewer.
So yesterday's statement speaks to a new set of directions for further providing clarity for the rephasing of children back into the schooling system. So just for clarity, for those who may not have heard it, may not have seen it, Mr. Mweli, can we just in a nutshell look at those again?
Yeah, maybe what I need to say, and thank you, Sakina, for affording me the opportunity to share this information. Maybe what I need to say is that we took advantage of the process of reviewing and strengthening our directions, and by inviting a number of stakeholders in basic education. As you know, that in the basic education sector, we've got a number of stakeholders. We convened meetings with the Human Rights Commission. We convened meetings with NGOs such as Equal Education, such as Section 27, a number of them. We had the whole day with them at what was the actions. And we also requested them to even make their own inputs and put forward how they would like the formulation of certain provisions to be in the directions. And that happened. And that culminated then in a process of bringing in teacher unions, bringing in the Association of School Governing Bodies, the association that represents people with disabilities, to look at whether the directions do articulate specific provisions. And one of the provisions which was not strong enough was around learners with special education needs. If you look at the new directions, there's a dedicated section now that deals with learners with special education needs, unlike before, where you had 3 or 4 liners that refer to learners with special education needs. But if we analyze the entire package, it's really about upfront issues of health, safety, in our schools and making sure that, we run schools that will ensure that through your non-pharmaceutical interventions, we're able to make sure that the virus is not spread in our schools.
So, with regard to those discussions that you said you had with the stakeholders, what legal concerns were raised by Equal Education and Section 27 around the constitutionality of previous directions?
Well, there are a few things. That they raised. One that comes right at the uppermost of my mind was around the issuing of permits, particularly to learners, and issuing of certificates. The initial directions required that learners be issued with a certificate, so that you are able to reduce the movement of learners. We also subjected that to Senior Council, and Senior Council agreed with some of the concerns that were raised by Equal Education and others. And as a result of that, we removed the certificate. We only left the permit across provinces, which both Senior Council and not only Equal Education and other NGOs were of the view that probably that would be required. The other issue was around deviation for schools from phasing in grades, certain requirements which schools had to meet. And this one came from the Association of Independent Schools, who felt that the fact that we expected them to first apply and the head of the department to send a team of officials to go and inspect the facility, and only after that then decide whether to grant permission or not. But what we have done in the new set of directions is that they could initiate grades other than the ones that are prescribed for public schools, and then take the responsibility of complying with health and safety requirements. And then the head of the department could then send a team of officials after they would have even introduced those grades. These are some of the concerns that were raised by different organizations.
Mr. Mweli, what has the data that you've gathered so far shown in terms of numbers of infections in schools throughout the country since the reopening?
Well, Sakina, I like reminding ourselves about the fact that we are dealing with a public health crisis, not an education crisis. And therefore, we take our cue from the Department of Health and health experts and professionals. So what has happened in the past 2 to 3 weeks that we have reopened schools is that we've picked up cases through our rigorous screening at school, cases from both educators and learners. And the data that came to us indicate that depending on where the infections have gone up, I mean, I would refer to provinces such as the Western Cape, Gauteng, and Eastern Cape. The number of teachers positive has been going up. But we must remember that it does not necessarily mean that the infections happened at school level. Infections happened in communities because, me and you, the same with teachers, are members of our communities. When we leave our places of work, we go back to communities. And therefore, if, infections are flaring up in communities, well, logically, they would reflect even in teachers and to some extent in learners. So we this data every week, and we're going to set up systems in the department, and there will be somebody who will really be championing, the issues of COVID-19, who's a medical practitioner, Dr. Kumar, leading the department in dealing with all of these things, getting our research, being well positioned to follow up these things, look at what is happening in the world, look at what is coming out of our schools, and making sure that we run functional schools in the, within this very difficult environment of COVID-19.
Mr. Mweli, you gave me a very detailed explanation, but you didn't quite answer my question. The question was very simply, in terms of numbers, what has your data shown, or do you not have that data?
Well, the numbers vary from day to day, Sakina. And the last numbers that I had, I think, were shared with us on Monday. And we didn't collate those numbers because they were given provincially. Provinces gave us their data. We could forward, the data to you either later today or so. But we're getting this information on a daily basis, and it keeps changing. It is every day.
Yeah, well, that's to be expected because it is a moving target and the data does change every day. But one would imagine that with the second phase of the reopening of schools, the department would at least care to, have a picture, a view of what has gone on before. Because last week it was reported that, for example, in Gauteng, 56 schools in this province alone were closed after educators and learners tested positive. Then you look at the Eastern Cape. It's reported that since the reopening of schools on June the 8th, there were 196 schools that again had to be closed due to infections. So it's just a question of, whether the department has a handle on these numbers, because there has been criticism about how you've handled these situations.
Well, I'm not sure whether you can blame education for handling a public health crisis. Our mandate is education, not health. And by the way, in instances where either learners or educators present with symptoms that require attention, health is immediately brought in. Every school is linked to a health facility and a health practitioner. So we're very careful not to assume the role of the Department of Health, because when it comes to, people having to be tested, it is the Department of Health that takes over. And that's why even in the Eastern Cape, the numbers that you talked about, I spoke to the head of the department in the Eastern Cape. He came to know about the figures later, because health was actually handling the situation and the information was given to them later.
Mr. Mweli, speaking to the Eastern Cape, yesterday I spoke to a SATU official in the Eastern Cape about a specific situation at Makaula Senior Secondary School near Mount Frere, where it was said about 206 learners and non-teaching staff actually tested positive for the coronavirus. And SATU was very upset about how the Department of Education dealt with the situation, going as far as saying that they tried to stop, the parents from knowing what was going on with the learners who had tested positive there. Teacher Union NAPTOSA says they warned the department against these sort of situations. How do you respond to these teacher unions, also to the public, the parents? Because in as much as you say that this is a healthcare crisis, and we all fully understand that, parents are sending their children to school in your department and they are under your supervision at that point.
No, I agree. And we then expected to then make sure that the health and safety of learners is something that is indeed guaranteed for learners. And from our point of view, schools have ensured that that happens. When symptoms were picked up from learners, the Department of Health was brought in. I do understand the concerns and the frustration raised by unions, but from the explanation that I've received from the head of the department in the Eastern Cape, I think they did what is humanly possible, as education officials. I think what happened is unfortunate in terms of communication between the Department of Health and the education there. And they took some time before they even communicated the information to parents. As I said to you, the head of the department said to me, he got the information very late when it was out in the public already. And I have advised him to take up the matter with his counterpart in the province, that should not happen anymore, because it causes an embarrassment for government and for the two departments.
So, Mr. Mweli, as you can imagine, parents are looking at this and they're saying, if you can have 206 infections at one school, and looking at, the practicality of the directions that you have actually released as a department, they are very concerned about sending more of the learners back to school. How do you allay those fears?
But Sakina, you remember the analogy that was made by Professor Karim of the small flames in a bush and fire extinguishers and trying to put out the flames in the bush. We need to link the infections or the number of cases of learners who tested positive and link it back to communities. If there's no correlation between the two, then I would say that maybe something wrong happened at school. And from the explanation that I got is that the infections are pointing back to communities where these children come from.
That may be the case, and there's no doubt that you will have local transmissions. But the fact of the matter remains as well, Mr. Mweli, that children may come to school negative and pick it up at school from other children. As you say, these are all members of communities that move around. As you say, the Department of Health told us it is not the virus that moves, it is people that move, and thereby moving the virus around. So this is what parents are concerned about, and they have been from the onset saying that what if it is the case that children go to school, they pick this up, and they come back bringing it to perhaps vulnerable members of their families?
Well, it is unlikely if children keep to the non-pharmaceutical interventions such as wearing their masks all the time, keeping to social distancing, sanitizing their hands and washing their hands regularly, and the classrooms are sanitized all the time. All over the world, if non-pharmaceutical interventions apply throughout the day in your schooling environment, the likelihood for infections to happen is very, very small.
So I'm listening to you, Mr. Mweli. I'm listening to even my colleagues who have children sighing very loudly because the reality is, if you take a school that has 206 infections, you do the precautions, and I would imagine that you are seeing to it. You have some sort of measure of actually monitoring that these directions are adhered to. Social distancing, washing of hands, that people's temperatures are taken as they enter the premises, and still you had that outbreak in that school. So when it comes to more children going back to school, what sort of responsibility are you willing to take if parents then decide that they are not sending their learners back until you can issue some sort of guarantee for them that their children will be safe?
Well, at first, our critics said we will not be ready. We won't have these pharmaceutical interventions, such as wearing of masks. They said we won't have them for all the children. They said we would not have the sanitizers. Children won't be able to adhere to social distancing. You can go to every school. We visited many schools. There is adherence throughout. And many parents have sent their children back to school, and many is because we have put these measures in place to protect our children.
Do all the schools at this point have proper sanitation facilities, Mr. Mweli? Are all the schools open that could cater for grade 7 and grade 12 learners? Were all of them opened? Not all the schools opened that could cater for grade 7 and grade 12. Those that could not open were schools that could not meet the health and safety requirements. As the directions clearly indicate that if a school does not meet the requirements, the school will not be allowed to open. Provinces have been updating that information on a weekly basis, and I think the numbers have reduced drastically from about 500. Currently, you've got less than 100 schools that are still closed because they wouldn't be able to meet the health, safety requirements and social distancing. Otherwise, the media would have picked it up, Sakina. They would have picked it up a long time ago, and people would have raised this in the social media. But that's precisely why I asked you the question, Mr. Mweli, because you say that people were critical. They said you wouldn't be able to meet all of this. You talk about 100 schools that haven't opened yet. Where are those schools? And I can bet my bottom dollar, those are schools in deprived areas, the poorest of the poor. Where are these schools that didn't open? No, I don't think you're right. Where are they? For instance, Gauteng had about 25 schools. Where? Where in Gauteng? They are spread across the country. But where, Mr. Mweli? Where? You can say Gauteng, that school can be in Sandton, or it could be in Diepsloot. Where are these
Yes,
100 schools?
In Sandton, it could be in a suburb. And some of the reasons that some of the schools had to close was also because of the fact that teachers reported first, and there were a number of COVID-19 positive cases that were picked up from teachers, and those schools remain closed until...
Where are the schools, the 100 schools that did not open, Mr. Mweli?
The 100 schools are across the country.
But wait, give me one, give me two. Just two. Give me two examples of where those schools are.
85 instead of 2 in Gauteng. And Gauteng is an affluent. In Western Cape, I think there were about 13 or 14.
No, that's not what I'm asking, Mr. Mweli. I'm asking you to tell me. Give me a name of a school. Tell me in which area that school is. Tell me Parkdale Primary in El Dorado Park did not open.
Sakina, I oversee 25,000 schools. You're asking me the question now. You want me to give you the name of the school. I don't think it's fair.
Okay.
But I'm giving you the...
Let me do this, Mr. Mweli. Let me do this. I'm going to ask you, Mr. Elijah Mhlanga is there with you. Ask him to check 1 or 2 schools while I ask you the next question, because I think it's also important. So the next question I want to ask you is for parents, because part of those directions that you issued actually speaks to those parents who decide not to send their children to school and the sort of directions that they would have to follow in terms of that. But Mr. Mweli, I believe our connection is going to cut. So can I please ask you just to check that for me? And I'm going to ask you to come back for 2 minutes after the news, just with those answers and that explanation, please. Mr. Mathanzima Mweli is the Director General for Basic Education and talking to us about COVID-19 infection concerns, as well as departments recently gazetted directions for schools. But it's time now for news with Leanne.